All right, well, colon cancer is the third most commonly diagnosed cancer and the second leading cause of cancer among death in men and women combined in the U.S. Now, the American Cancer Society estimates that 143,000 people will be diagnosed this year and that 51,000 will die. Now, Dr. Kyle Barnett joins us right now. We're going to talk a lot about this, but first of all, what are the symptoms of colon cancer?
Well, colon cancer can present in a variety of different ways. Most commonly, patients will notice some blood in their stool, abdominal pain, weight loss, and unfortunately, that can indicate an advanced cancer.
And also, unfortunately, you can't really prevent this until you see the symptoms unless you go get checkups and everything to prevent finding out they have cancer. Right,
and that's why it's important to be screened for colon polyps, which are the precursors for colon cancer, because unfortunately, the main symptom of polyps and precancerous lesions is no symptoms at all. So it's a fallacy to think that I don't have symptoms, I shouldn't be screened. And so if you meet the appropriate screening criteria, you should be screened.
And kind of look at those risk factors in your family. Does it run in your family history? At what age do you think men and women should go?
Well, the recommendations that are all men and women at the age of 50 should be screened initially, and then depending on what the findings are, the subsequent screenings will be determined at that time. However, there are some people at high risk, and those would include patients with a family history of either colon polyps or colon cancer. There are some inherited forms of colon cancers that we look at as well.
Once you find out, or once you see that you're having symptoms, you go to the doctor, you are diagnosed with colon cancer. What are the options at this point?
Well, the options include surgery, chemotherapy, radiation therapy. It depends on how advanced the cancer is, and oftentimes we don't know that until the cancer is taken out. But even if we diagnose a cancer at a very early stage, colonoscopy can remove that cancerous growth and cure somebody.
And another thing, how do you cope with that? How do you have to go and tell someone they have cancer, then what does that patient need to cope with that news?
Well, there's a lot of support groups out there and a multi-team approach from the surgeon to the gastroenterologist to the oncologist. A lot of support for both the patient and the families.
The families need it too, that's a good point.
Family needs it as well, and so to avoid having a colonoscopy because you don't think that it's going to affect you is kind of silly, because you have to look at your family members, you have to look at your children, you have to look at your grandchildren. And so, you know, don't be silly. It's a simple test, takes 20 minutes of your time. You don't have to do it that often, and it may save your life.
The moments of discomfort are certainly worth saving your life, right?
Sure, and the vast majority of people have that exam done sedated. They have to do a colonoscopy prep, which has improved significantly over the years. But the procedure itself, you're asleep, and so it's not an uncomfortable procedure.
And with people with these risk factors, how often do you see these polyps and you're able to eliminate them before they do turn into cancer?
Well, 20 to 30% of people over the age of 50 are going to have polyps, and some of those are precancerous polyps. So removing those polyps will virtually eliminate your risk of developing colon cancer.
And then you did your job. You went and got screened, and you're in better health now.
Right. You can check that off your list.
All right, Dr. Kyle Barnett, thank you very much.
All right. Thank you for having me.